And by the Friday, I landed in Roberts International Airport in Monrovia, and it soon became very clear that Ebola is real and is still there. And at that point, the nighttime curfew had just finished, but people weren't allowed to congregate in crowds, and the schools were closed, churches were closed, so it was a country very much in lockdown at that point, and quite a surreal experience. Arrived at night, it was really a busy airport, although you weren't supposed to congregate in crowds, but you could there to get in or out of the country. And we went along to our base in Monrovia itself. So, as mentioned, that Médecins Sans Frontières have a number of operations. We were based in Monrovia, capital of Liberia, which is a population of about 1.5 million. Liberia itself has a population of about 4.5–5 million, so about the size of population of Scotland, really. But they also had a number of treatment units dotted around. And the one that we were working on was in the capital, which was really the hotspot for Ebola infection at that time. And this is it. I don't know if you can all see that, but I'll just talk through it. This is the camp that we were in. It's called ELWA 3. ELWA was the name of the district that we were based in. It's called Eternal Life Awakening Africa. It's set up by missionaries, this area. And this is the largest ever treatment unit for Ebola that's been created. It could hold 250 patients at one time. It had just about 2,000 admissions. 1,200 of them had Ebola, and 512 of them survived in the period that it was open from August till March. And it had, as I say, 250. It was a 250 bedded facility. Each one of these little tents here, it's quite a big tent actually, it holds 30 patients, and I'll talk to you in a moment how we get them, but this is a tent for patients who we suspect may have Ebola. These ones are for patients who are critically ill, and this one was for patients who were convalescing, who recovered. And at its peak, as I mentioned, there was probably 30 to 40 admissions a day, and upwards of 20 to 30 deaths a day. So, this is my team. Every day I would pick the loudest shirt I could find from a selection, but we were quite experienced, really. I was a nurse, as you know. Maria is a nurse who'd worked quite a lot in voluntary work in Africa for a number of years. Maria was a GP from Spain, but she'd been in Gekadu when this kicked off. She'd been working there in the MSF facility. This guy Pete, he's a nurse also, a trials coordinator in Manchester. He's got his own company. He's a very driven guy. Alex was an intensive care consultant from Canada, and Jake, the boss at the back, the handsome guy at the back, he'd been out there since the very beginning for Oxford University, setting up, trying to find the best place to host a clinical trial. I'm not going to talk too much about the trial, I'll mention towards the end. So this is us before we were working every day. We'd get dressed up, and you'd probably change these five times in a day because it was so hot. This is us before we go into work. With our suits on, and these are protective gear, so every part of us is covered over, so that we're going into a high risk area, and I'll mention this in a moment or two. So
is the one at the left you?
This is me here, Steve, with the fingers up. Yeah. You tell by the eyes, can't you? Yeah. You're very good. This is why we write our names on the top of them as well. You write your name on your head as you're going in. I get somebody to write your name. You write it on your top of your head so that we know who we're dealing with. We also write it on our backs as well, so because we're working in a team when we're in there, so everyone knows what their task is when they go into that hot area where the patients are, and where you know that there's definitely Ebola.